Welcome back to the Lost Book of Herbal Remedies. I'm Emma.
And I'm Alex. Today, we're diving into a topic that has seen significant advancements in research: cystic fibrosis, a life-threatening genetic disorder that affects thousands of people. While most people associate cystic fibrosis with lung issues, recent studies show that it impacts so much more.
That's right, Alex. Cystic fibrosis results from mutations in the cystic fibrosis transmembrane conductance regulator, or CFTR gene. This mutation leads to the production of thick, sticky mucus that clogs the airways, trapping harmful bacteria and causing chronic infections and inflammation. But what's even more complex is that cystic fibrosis doesn't just stop at the lungs.
Exactly. Cystic fibrosis impacts multiple systems in the body, including the kidneys and the body's metabolic processes. One of the big focuses in recent research is something called metabolic alkalosis. It's a condition that occurs when the body's pH becomes too alkaline, and it's a common complication in cystic fibrosis patients.
Metabolic alkalosis happens when the kidneys can't properly excrete bicarbonate, especially during periods of excessive sweating, which is common in people with cystic fibrosis. One of the main players here is the pendrin protein, which helps regulate the body's acid-base balance. When pendrin doesn't function properly, patients can end up with metabolic alkalosis alongside chronic respiratory acidosis.
It's such a delicate balance. One case study described a 24-year-old woman with cystic fibrosis who had symptoms of metabolic alkalosis. Her body was losing chloride through excessive sweating, and this impacted her kidney function, making it harder for her to maintain the right balance of bicarbonates. It's a prime example of how interconnected the systems in our body really are.
It highlights how crucial it is for doctors to monitor not only lung function, but also the body's metabolic processes in cystic fibrosis patients. Treatments that target pendrin and address fluid balance through proper hydration and electrolyte replacement could significantly improve outcomes for patients.
But that's not the only challenge people with cystic fibrosis face. Bacterial infections, especially those caused by Pseudomonas aeruginosa, are a major contributor to the disease's progression. This bacteria forms biofilms, which are thick layers of bacteria that are extremely resistant to antibiotics.
What makes Pseudomonas aeruginosa so tough to treat is its ability to communicate through a system called quorum sensing. This system regulates the bacteria's behavior based on population density, allowing it to become more virulent when necessary. But recent research is shedding light on how we might disrupt this communication.
A promising area of research involves histone deacetylase 6, or HDAC6 inhibitors. These inhibitors reduce the production of key virulence factors like pyocyanin and rhamnolipids, which are essential for biofilm formation. By impairing the bacteria's ability to form biofilms, it becomes more vulnerable to antibiotics and the immune system.
This approach could be a game changer for cystic fibrosis patients, especially those who have struggled with chronic infections. If we can reduce the bacteria's ability to form biofilms, it opens the door for better treatment outcomes.
Another innovation in treating bacterial infections in cystic fibrosis patients involves phosphatidylserine liposomes, or PSL. These have shown promise in combating Mycobacterium abscessus, a particularly tough infection. PSL enhances the body's macrophages, the cells that destroy pathogens, improving their ability to kill the bacteria.
And PSL doesn't just improve antibacterial action, it also reduces inflammation. That's a huge win for cystic fibrosis patients because inflammation plays a major role in the progression of lung disease. Combining this with conventional antibiotics could significantly shorten treatment time and reduce the risk of drug resistance.
It's incredible to see how these therapies are evolving, but let's not forget about the importance of monitoring lung health in cystic fibrosis patients. Traditionally, chest X-rays have been the go-to method, but they come with the risk of repeated radiation exposure.
Lung ultrasound is emerging as a radiation-free alternative. Recent studies have shown that lung ultrasound can provide comparable insights to chest X-rays, especially when it comes to detecting abnormalities that X-rays might miss. This makes lung ultrasound a safer and potentially more effective option for long-term lung monitoring.
That's especially important because cystic fibrosis patients require frequent lung assessments. By using lung ultrasound, we can reduce radiation exposure while still getting critical information about the patient's lung health.
But like all things, lung ultrasound has its limitations. It might not be as effective for patients with mild pulmonary disease, so there's still more research needed to determine how to best use it in clinical practice.
The key takeaway here is that with the advancements in understanding both bacterial infections and the metabolic aspects of cystic fibrosis, we're seeing a much more comprehensive approach to treatment. The future of cystic fibrosis care looks brighter as these new therapies and diagnostic tools come into play.
Speaking of comprehensive care, let's talk about how herbal remedies can support people with cystic fibrosis, especially in areas like lung function, infection control, and inflammation. These remedies are designed to complement, not replace, conventional treatments.
That's right. For improving lung health and regulating mucus, ivy leaf is an excellent option. It has mucolytic properties, which means it helps break down thick mucus, making it easier to clear from the lungs.
And thyme is another great herb for respiratory health. It offers both antimicrobial and expectorant properties, which help the body fight off infections while clearing mucus.
Licorice root is also worth mentioning. It has anti-inflammatory and expectorant properties, soothing irritated mucous membranes and aiding in mucus expulsion.
For kidney function and metabolic balance, dandelion root and nettle leaf are valuable herbs. Dandelion root acts as a natural diuretic, supporting kidney function, and nettle leaf is rich in minerals that help regulate metabolic processes.
Garlic and turmeric also stand out for their antimicrobial and anti-inflammatory effects. Garlic targets bacterial infections like Pseudomonas aeruginosa, while turmeric contains curcumin, which can help manage biofilm production and reduce inflammation.
And for immune support, echinacea and omega-3 fatty acids from sources like flaxseed or algae are beneficial. Echinacea boosts immune function, and omega-3s reduce inflammation, which is crucial for people with cystic fibrosis.
Green tea and ginger offer antioxidant support. Green tea protects against oxidative stress, while ginger supports immune health and helps with inflammation.
Of course, it's important to consult with a healthcare provider before starting any new supplement regimen, especially when dealing with a condition as complex as cystic fibrosis.
Absolutely. And with all the recent breakthroughs, combining traditional treatments with supportive herbal therapies could lead to improved outcomes for cystic fibrosis patients.
That's what's so encouraging about this research. Whether it's targeting pendrin to improve metabolic balance or reducing bacterial virulence, every piece of the puzzle brings us closer to better management of cystic fibrosis.
And that's something we all want: better outcomes and a higher quality of life for people living with cystic fibrosis.
Thank you for joining us today on the Lost Book of Herbal Remedies. If you're interested in learning more about cystic fibrosis, these treatments, and how herbal remedies can support health, visit us at herbalbloom.org.
Be sure to subscribe so you don't miss our next episode, and we'll see you next time.
Take care.